Atolagbe Simeon.
Yes, I'm currently on the video.
Yeah, good morning, everybody. And I want to welcome you to this meeting. I'm sure you reflect your very able to be here today. We are not taking that for granted. We actually appreciate your coming. Yeah, my name is Femi. I'm Femi Atolagbe. I'm the managing director of Marcson Healthcare Ltd. Marcson Healthcare Ltd is a very young company. We started operation in 2012. So when you look at it, we're about 12 years old. But in terms of experience of people behind Marcson, we have people who are vast experienced in sales and marketing of pharmaceuticals. And when you put those experiences together, so if we tell you that Marcson is 100 years old, we are not telling lies, because it's people by people with people with vast experience in sales and marketing of pharmaceuticals. We are not just want to be like others. We want to be different. We want to differ in terms of value we had to the healthcare system in Nigeria. So we are not just giving products, we are not just selling products. We also want to be different in terms of what value we can add. And that's part of what we are doing today. We are launching one of our products, MARC-BLAST, for the treatment of wound. I'm sure is also the number is the first type in Nigeria. But we are also looking at how can we share best practices, international best practices in the management of wound. People have recognized China generally in areas of wound repairs and wound healing. So we also want to know how China is going about it. And so we are also inviting somebody who will be speaking with us today on the China approach to management of wound healing. I'm talking of Professor Yang, wound repair. He was scheduled to be here, but unfortunately, due to logistic reasons, he could not be here today. So he will be speaking with us directly from China, and after which that will follow the products after the product presentation. I can assure you that you will not regret coming here. And for the people watching us all over Nigeria and even beyond, I'm sure the time you are also living to listen to us, to watch this, will be a valuable time. I'm sure it will worth the effort. This is not I'm not here to give speech really, but just to tell you what Marcson is all about, which I think I have done in summary. I'm sure that people will join us as we progress in this meeting. I want to say welcome again. I want to say thank you for coming. Welcome. Thank you very much.
Thank you very much. Once again, you are welcome, both online and offline. Immediately now, we'll be having our first presentation by Kelvin. Please, once again, there's a barcode on your table. The barcode is to be scanned. When you scan it, it directs you, because of time, we don't want questions to delay. It will direct you to a WhatsApp group just ask your questions, as you can type in your questions there as the presentation is going on, and every of these questions will be taken care of before we leave. Thank you very much. So the next presenter, I welcome Kelvin.
Good morning, everyone. This is Kevin from Mela Hope. I am truly honored to be invited here to deliver this presentation to introduce MARC-BLAST. And I would also like to express my gratitude to our partner, Marcson Healthcare Ltd, for organizing this event and for all the efforts you made to launch MARC-BLAST in Nigeria. So, what is BFGF? The BFGF, which stands for Basic Fibroblast Growth Factor, also known as FGF2, is a multifunctional peptide encoded by FGF2 gene in many cells, for example, macrophages. BFGF is an important growth factor in the body. It has been implicated in many biological processes, such as limb and nervous system development, wound healing, and so on. Among its various biological effects, promoting wound healing is the most significant function. So, how do wounds heal and how does BFGF work? The wound healing process is classically divided into 4 overlapping stages: hemostasis, inflammation, proliferation, and remodeling. The hemostasis stages happens immediately within a few minutes of injury. First, when there is a wound, the blood rushes out to clean the wound and get rid of germs and other microorganisms. The erythrocytes will then make a tight seal to protect the area. After that, the platelets will stick to the wound and release substances to form a clot. The clot is like a temporary scaffold structure that helps important cells move to the wound, and it also contains substances that help stop bleeding and heal the wound. During this stage, the BFGF powder can be applied directly onto the wound after debridement, allowing it to work on the wound directly and help control bleeding. The inflammation stage happens 1 to 4 days after injury, which focuses on cleaning the wound and preparing for new tissue formation in the wound. During this stage, neutrophils are like a tiny vacuum cleaner that swallow dead tissue and bacteria at the wound. After they finish their job, they will perish and get cleaned up by macrophages. Macrophages also secrete a number of tissue healing factors, such as growth factors and other cytokines. These factors attract cells involved in proliferation stage of healing to the area. During this stage, applying BFGF either by wet compressing or by negative pressure wound therapy with instillation can modulate the inflammatory response at the wound site, which indirectly influences cell proliferation. By promoting the resolution of inflammation and transitioning to the proliferative phase of wound healing, BFGF can help create a favorable microenvironment for cell proliferation and tissue regeneration. The proliferation stage happens 4 to 21 days after injury. During this stage, the modulation of fibroblast toward myofibroblast promotes the formation of granulation tissue. By gripping the wound boundaries and pulling them together, the wound is gradually closed. In this stage, the temporary fibrin clot formed in the hemostasis stage will be replaced by a new matrix made of collagen type 3 fibers and other proteins to restore the structure and functions of tissues. To apply BFGF in this stage can exert its effects of promoting proliferation during wound healing by directly stimulating the proliferation of fibroblasts and other cytokines, promoting formation of new vessels, recruiting and activating stem cells, and etc. These actions collectively contribute to enhance tissue repair and accelerated wound closure. The remodeling stage happens around 21 days after injury. Closure of acute and chronic wounds is regarded as the wound healing endpoint in most clinical settings. Yet wounds can continue to undergo remodeling or tissue maturation for months and even years. During this stage, macrophages, fibroblasts, and other cells previously present in the wound environment will perish and the capillary will stop growing, with a standstill and a reduction of losing cells and blood vessels. Collagen type 3 fibers that previously makes up the majority of granulation tissue will be gradually replaced by the stronger collagen type 1 fibers as the wound heals. This final stage of wound healing decides whether scarring. In this stage, using BFGF before wound closure can help the decomposition of extra collagen, inhibit collagen excessive deposition in the tissue, thus reducing the risk of scar formation. So, how can BFGF reduce risk of scar formation? Studies have shown that the earlier the wound heals, the lower the incidence of scarring. For wounds healed within 14 days after injury have a lower incidence of scarring. For those healed between 14 to 21 days after injury, the incidence of scarring is 30% to 35%, mainly hypertrophic scars. For wounds healed beyond 21 days, the incidence of scarring can be as high as 50% to 83%. The BFGF are known to stimulate the proliferation of various cell types involved in wound healing, including fibroblasts, which are crucial for collagen synthesis. By promoting the growth of these cells, BFGF can accelerate the wound healing process, leading to reduced risk of scar formation. BFGF influence the synthesis and remodeling of collagen, which is the primary component of scar tissue. By promoting the deposition of organized collagen fibers and regulating their alignment, BFGF can contribute to the formation of a more mature and less visible scar. That's why we say it is recommended to use BFGF as early as possible in the wound healing process to accelerate healing, which helps reduce the risk of scarring. Let's see a case that shows how BFGF can reduce the risk of scarring. This is a 5-year-old child who admitted a soft tissue infection and localized skin necrosis on the right shoulder. As shown on the picture, when this child is hospitalized, thorough debridement was conducted to remove dead tissue in the wound, and anti-infection treatment was given. After 4 days of treatment of BFGF, with routine disinfection and local debridement, the granulation tissue started to grow locally, and as you can see, there was no exudation, which dissociated skin and subcutaneous tissue between the two incisions. After 14 days treatment of BFGF, as you can see, the wound was closing and the granulation tissue was growing well. After 45 days of treatment of BFGF, the wound is well healed and there's no obvious scar. To sum up, why it is better to treat wounds with BFGF. First of all, it accelerates wound healing. Quicker healing reduces the chance of scarring. Secondly, it promotes the formation of new vessels in the tissue, which improves local blood circulation. Thirdly, it stimulates proliferation of multiple epidermal cells, which help restore skin functions. And next, it promotes tissue repair, thus reduces the risk of infection. And finally, it facilitates nerve repair to help restore sensory functions. And that's our product, MARC-BLAST. Let's have an overview of the specifications of MARC-BLAST. This drug contains 30,000 units of BFGF in the form of freeze-dried powder. which needs to be reconstituted before applying to the wound site. It can promote wounds to heal faster, thus reducing the risk of scarring. The longest stability test we did on this drug is being stable for up to 36 months if stored at 2 to 8 Celsius degree, but it is advised to use it within 24 months. Once you reconstituted this drug, you have to keep it at 2 to 8 Celsius degree and use it up in 7 days. If the storage temperature accidentally falls to, let's say, 0 Celsius degree for some time, the powder will be frozen to a round cake, but it is okay to use, and it will not affect its fixing. Then let's see what's in the package. After opening the box, you'll find 4 items. First, the BFGF lyophilized powder, and second, the 5 ml steroid water here, and a medicinal spray pump here, and an inner insert here. Let's move to the reconstitution process of MARC-BLAST. After unboxing and reading the package insert, you should place the BFG powder, the 5 ml steroid water, and the spray pump on a clean table. First of all, you should remove the aluminum cap on the vial. Then you should unscrew the upper part of the silicone ampoule that contains the 5 ml steroid water. Secondly, remove the rubber stopper of the vial, then remove the protective film of the spray pump. Thirdly, you should pour the steroid water into the vial and then assemble the spray pump. And then remove the cap of the pump, and now it's ready for spraying. If you need to apply it in other methods, then the assembly of the spray pump is not necessary. Next, let's find out the dosage of MARC-BLAST. The economical dosage of MARC-BLAST is 150 units per cubic centimeter. The MARC-BLAST powder can be sprinkled on the wound site directly without reconstitution, and after reconstitution with 5 ml steroid water, MARC-BLAST can be applied by spraying, flushing, wet compressing, negative pressure wound therapy, etc. The volume of each spray of MARC-BLAST is approximately 0.1 milliliter, and it is better to spray MARC-BLAST 4.6 centimeters high above the wound. For dressed wound, it is advised to change the dressing and apply MARC-BLAST once every other day. For undressed wound, it is advised to apply MARC-BLAST 4 to 5 times a day. The actual MARC-BLAST dosage and frequency of changing the dressing vary with actual situations. For different wounds, the methods of applying MARC-BLAST can be different. For fresh wounds, we can apply the powder onto the wound directly. For superficial wounds, we can spray the solution onto the wound. For hard-to-reach wounds, we can flush or rinse the wound site with the solution. For normal surgical wounds, we can apply the solution by wet compressing. For severe surgical and chronic wounds, we can apply the solution by conducting negative pressure wound therapy with VSD devices. To maximize the effectiveness of MARC-BLAST, it must be applied with the correct procedure every time. The prerequisite for application of MARC-BLAST is thorough debridement. It should not be used directly on contaminated or infected wounds. MARC-BLAST is not recommended for wounds with severe inflammatory reaction and obvious exudation. The very first step to conduct a thorough debridement to the wound, either by sharp debridement or other debridement methods. And the second step is to apply MARC-BLAST using the methods mentioned before. The third step is to continually apply MARC-BLAST until the wound is fully healed. During the healing, we may need to conduct re-debridement. If the patient has diabetes, we need to control the blood glucose condition when applying MARC-BLAST. And make sure to change nutritions regularly for dressed wounds. Here are some cautions for using this product. Before using this product on patient, the wound site must be thoroughly debrided. And secondly, do not apply this product to patients with a malignant tumor at the administration site or a history of the malignant tumor.
This product has a promoting effect on cell proliferation. And next, do not apply this product to patients with a history of hypersensitivity to the components of this product. And finally, once the wound is fully closed, applying this product on the wound site won't be effective anymore.
Okay, sorry for the technical issue again, and let's continue. And here are some frequently asked questions about MARC-BLAST. First is, how long is MARC-BLAST applicable during this healing process? MARC-BLAST can be applied in all wound healing stages after debridement, until the wounds have sufficiently healed. And secondly, what is the healing time for different wounds and how many days does it take to heal? The healing time for different types of wounds is different. Superficial wounds may heal in a few days, and deeper or chronic wounds may take months or even longer time to heal. And thirdly, regarding the temperature fluctuations below 2 or above 8 degrees, how long is MARC-BLAST still effective? And is it safe to use after such events, like breakdown during transit? And the answer is, MARC-BLAST has undergone stability testing at a normal temperature of 25 degrees. And its quality remains stable for up to 1 week under these conditions. In cases of temperature between 0 to 2 degrees, the freeze-dried powder nature of MARC-BLAST ensures that it remains unaffected. If the temperature rises above 8 degrees due to the unforeseen circumstances such as a breakdown during transit, it is stored in a thermal container with an aspect. It will not rapidly lose its quality. And next, can MARC-BLAST maintain its effectiveness outside the 2 to 8 degree range? And yes, MARC-BLAST can remain effective outside this range for a short duration, but no more than 1 week before dissolution. However, we strongly recommend keeping it within the specific temperature range. After dissolution, it must be stored between 2 to 8 degrees, as the protein inside it can degrade rapidly outside this range, thus making it unusable. Due to time constraints, I've compiled a set of questions and operational tutorials, and I uploaded them to the Google Drive. You can easily access them by scanning the QR code here for downloading and viewing. And this is the end of my presentation. Thank you.
Thank you once again. And sometimes the unplanned happen. So we are going straight to one of our doctors also from China, who is unable to make it here due to logistic reasons. So he will be presenting to us now immediately. So I just want to read his citation, and it starts immediately. So Dr. Yang Ronghua, Department Director, Chief Physician, Doctoral Supervisor, Department of Bones, Plastic Surgery and Wound Repair, Second Affiliated Hospital of South China University of Technology, Honors and Qualifications, Visiting Scholar at the Taiwan Bone and Plastic Surgery Center, winner of the 8th Good Doctor of Guangzhou Award, winner of the Distinguished Young and Middle-Aged Doctor of Guangdong Award, review expert of the National Natural Science Foundation of China. Social services includes member of the International Society of Burns Injuries, member of the Chinese Burn Association, youth editorial board member of Burns and Trauma Journal, standing committee member of the Cosmetics Medicine Committee of Chinese Research Hospital Association, member of the Scar Medicine branch of the Chinese Association of Plastic and Aesthetic. Is also the vice chairman of the Burns and Wound Repair Society of Guangdong Medical Association. He is the first and corresponding author, published more than 50 articles in SCI journals with a total impact factor exceeding 200. Served as editors for 2 books, Key Points in Burn Treatment and Plastic Surgery Techniques, and also Burn Medical, As the first and corresponding author, published more than 50 articles in SCI journals with a total impact factor exceeding 200, served as editor for 2 books, Key Points in Burns Treatment and Plastic Surgery Techniques, Modern Surgical Disease Diagnosis and Treatment, Thoughts and Practices. Led 3 projects funded by the National Natural Science Foundation of China, as well as multiple provincial and municipal projects. Also obtained 2 utility patents. Kindly join me in welcoming on-site Dr. Yang for his presentation. He will be sharing from his wealth of experience about the use of MARC-BLAST, also in debridement, and he will be telling more about the product itself. Thank you. Dr. Yang, you have the floor.
Thank you. Good morning.
Good morning, distinguished colleagues and experts. I am Yang Ronghua from the Departments of Burns, Plastic Surgery, and Wound Repair of Guangzhou First People's Hospital. At the invitation of Mellow Hope Biopharmaceutical Corporation, I am here to have an online exchange with Nigerian experts. The title of my report is The Role of BFGF in Promoting Wound Healing and Case Sharing. I will expand this report from 6 aspects. First, the introduction of BFGF. BFGF, also known as FGF2 internationally, is the polypeptide that promotes the division of mesoderm and neuroectoderm cells. It has a small molecular weight, a specific amino acid sequence, and a 3-dimensional structure. As shown in the figure on the left, it has high stability and can maintain long-term biological activity. BFGF has multiple physiological effects that are necessary for wound healing, including promoting self-division, angiogenesis, chemotaxis, and self-migration. So, how does BFGF promote wound healing? First, it regulates the cell cycle and accelerates cell proliferation and migration. After, it binds to FGFRs on the cell surface. BFGF activates multiple signaling pathways and accelerates cell DNA synthesis and proliferation. On the other hand, BFGF can stimulate cell migration, including fibroblasts and epithelial cells. and accelerate wound coverage and healing. Second, it optimizes collagen synthesis and improves tissue strength and toughness. BFGF can promote collagen synthesis, increasing the content of collagen in wound tissue, and optimize the synthesis and arrangement of collagen. Third, it activates signal pathways and improves the local microcirculatory environment. BFGF can activate multiple signal pathways such as MAPK, PI3K, AKT, etc. It improves the local microcirculatory environment of the wound and promotes angiogenesis and blood perfusion. BFGF promotes more oxygen and nutrients to the wound and creates favorable condition for wound healing. The previous section introduces BFGF and its role. For the next step, let's go through the biological basis of wound healing. From the perspective of wound type, they are clinically divided into acute wounds and chronic wounds. Acute wounds mainly include surgical incisions, trauma, burns, etc. And the healing process is usually relatively rapid. Chronic wounds mainly include diabetic foot, venous ulcers, etc. And the healing process is relatively slow and can be easily affected by multiple factors, such as infection, ischemia, malnutrition, etc. The wound healing stage can be divided into 4 consecutive stages: hemostasis, inflammatory response, self-proliferation, and matrix deposition. Each stage has its own specific biological process and self-participation. In 2020, the Chinese Medical Association's burn branch published the Chinese guideline for the use of growth factors, English version, which is also the first international guideline for the use of growth factors. The guidelines introduced the indications and recommendation level of virus growth factors, among which BFGF has the widest range of indications and can meet the treatment needs of most acute and chronic wounds in clinical practice. Burn wounds are rated as strongly recommended among all the indications of BFGF. The guidelines also supplement the experience of using growth factors as below. Since growth factors exert their effects by rapidly contacting receptors, once or more applications per day are appropriate. The dosage range of BFGF is 75 to 300 IU per square centimeter. Increasing the quantity of medications or extending the moisturizing time can significantly shorten the wound healing time. BFGF can be used for superficial and deep second-degree burns in children. BFGF is safe and have not caused any direct toxicity or adverse reactions. General application methods of BFGF include dry compress, sprinkle, wet compress, NPWTI, and spraying. For example, dry compress is used when there is a lot of wound exudates. The freeze-dried powder is crushed directly under aseptic operation and applied to the wound to allow it to absorb the wound exudate and dissolve, thereby increasing the drug concentration on the wound. Different negative pressure perfusion therapies can be combined with flushing treatment. For continuous flushing, BFGF can be mixed into a flushing solution to flush the wound surface. For intermittent flushing, BFGF can be added to a sponge to soak the wound before turning on the negative pressure. Next, I will share several clinical cases to demonstrate the use of BFGF in wound repair. In case 1, we treated a 2-year, 8-month-old boy. Both his upper limbs were scalded by boiling water for 2 hours, diagnosed as 4% scald by boiling water, deep 2-degree burn. Children are lively and active, and scalding is the most common accident. Parents are very concerned about the speed of wound healing and the quality of wound repair, such as scar hyperplasia and pigmentation. After surgical debridement, the patient was given BFGF by dry dressing, which is powder sprinkling due to the high amount of wound exudate, with appropriate bandaging and dressing changes every other day. 11 days after the surgery, the wound was basically healed and part of the wound was red. In case 2, we had a 5-year-old girl who had her left upper limb scalded with boiling water for 3 hours and was diagnosed with 3% scald with deep 2nd-degree burn. The patient's wound had relatively less exudate, so a wet dressing was employed. After BFGF was dissolved, the wound was bandaged with moistened gauze with BFGF, and the dressing was changed every other day. 10 days after the surgery, the wound was basically healed. In case 3, a 5-year-old boy was suffering from extensive burns on the trunk and upper limbs, covering an area of about 20%. He was diagnosed with severe burns in children. He was admitted to the hospital on April 15th. There were blisters of varying size distributed on his trunk. The base was pale. Some wounds were dull to tenderness and had a lot of serious exudate. He was given fluid infusion and anti-shock treatment. On April 19th, surgical debridement was performed, and the wound was covered with a xenogenic cellular biomatrix dressing and gauze moistened with BFGF. We changed the dressing every day and covered his wound with gauze moistened with BFGF until the wound heals. Follow-up after half a year showed no upwards pigmentation or scar formation. Case 4. A 25-year-old female was exposed to a spray of high-concentration chlorine-containing disinfectant and was admitted to the hospital with erythema and burning pain on the left buttock for 2 hours. She was diagnosed with chemical skin burns. The patient is a medical worker who accidentally came into contact with a high-concentration chlorine-containing disinfectant during the COVID-19 quarantine period. Chlorine-containing disinfectant can be quickly absorbed after direct contact with the skin, causing acute poisoning, redness, swelling, blisters, and severe pain on the skin. After the blisters are absorbed, hyperkeratosis will occur. Some patients will experience scar hyperplasia and infection, which affects their appearance. Upon admission, large pale red patches and mild edema was seen on the left buttocks, with local epidermal exfoliation in the center of the lesion, giving it an abrasion-like appearance. The wound was routinely cleaned. BFGF was applied twice a day to promote wound healing, and red light irradiation was applied twice a day, 20 minutes each time. After treatment, the pain in the affected area was significantly relieved. The original skin lesions formed dark red scabs. There was a small amount of local exudation, and there was no redness or swelling around them. On the 9th day of treatment, the wound surface was dry, without exudation, and local scabs had fallen off. On the 20th days of treatment, there was no pain in the affected area. All scabs had fallen off, and the skin was not dry or scaly. Follow-up after 50 days showed that the skin tissue grew well, with only light red spots seen locally. There is no scar formation and no adverse reactions. In case 5, there was a male, 41 years old, cut his right calf with an angle grinder. The cut on the right calf caused pain and bleeding for 11 hours. He was diagnosed as an open incomplete fracture of the right tibia. A wound about 10 cm can be seen on the anterior and lateral side of the lower right leg, reaching deep into the tibia bone. Part of the bone is missing and mixed with a small amount of soil, which is heavily contaminated. We conducted emergency debridement, exploration plus MPWTI placement surgery, which include thorough debridement, removal of foreign matter and necrotic tissue, removal of free small bone fragments, trimming of skin edges, and surface application of MPWTI device. After surgery, the wound of the affected limb is continuously suctioned with negative pressure. We turn off the negative pressure and dissolve the BFGF to inject it into the wound through the tube. After continuous soaking for 15 to 20 minutes, the negative pressure is turned on, and the above process is repeated every 2 days. 1 week after surgery, the MPWTI device was removed, and no obvious adverse reactions were found in the wound, with only mild local redness and swelling and a small amount of exudation. Thereafter, every 2 days, the wound was covered with sterile gauze of appropriate size, and BFGF was dissolved and evenly added to the gauze for bandaging. The wound was healed, and the stitches were removed 2 weeks after surgery. 11 days after surgery, the wound exudation was significantly reduced, and the edema was reduced compared with the last time the wound was opened during the dressing change. After iodine disinfection, the gauze was wiped dry, and the gauze moistened with BFGF was continued to be applied externally. 2 weeks after surgery, the wound was healed without obvious swelling or exudation, and the sutures were removed. The patient only received BFGF treatment for 2 weeks, which allowed the contaminated wound to heal quickly and avoided complications such as infection and skin necrosis. In case 6, we had a 40-year-old male bitten by a dog on his right hand with pain and bleeding for 1 hour. He was diagnosed as hand injury, skin laceration, and dog bite. An arc wound of 3 cm can be seen on the back of the right hand, with full-thickness skin lacerations, exposed subcutaneous tissue, active bleeding, and contaminated wound surface. We cleaned the wound thoroughly, removed necrotic and inactive tissues, and sprayed BFGF solution on the wound surface. The wound was sutured later. Since the dog bite wound was contaminated, a film was left inside the wound for drainage. In the first day after surgery, there was no obvious redness or swelling in the wound, and a small amount of light bloody fluid was seen draining out. We disinfected the wound and removed the drainage film. We took 1 vial of BFGF, dissolved it, and wet the gauze with it. We applied the wet gauze to the wound surface and bandaged it. In the 3rd day after surgery, there was no obvious redness or swelling in the wound, and no obvious exudation. We disinfected the wound and dissolved 1 vial of BFGF to wet the gauze. We applied the wet gauze to the wound surface and bandaged it. as the dog bite wounds are contaminated and are prone to infection. We advise the patient to change the dressing every 2 to 3 days and apply BFGF white compress after surgery. Each time we change the dressing, we dissolve the BFGF and spray the solution on the wound 4 to 5 cm away, 3 to 4 sprays each time, and then cover the wound with the dressing. 12 days after the surgery, the sutured wound healed well, with no obvious redness, swelling, or exudation. There was good apposition and no obvious hypertrophic scar formation. In the previous section, some cases were used to introduce the common method of BFGF application, including dry compress, which is powdering, and sprinkle, wet compress, flushing, which is MPWTI, and spraying. Due to time constraints, the following cases will be briefer. This is the preparation of wound bed by BFGF combined with negative pressure perfusion therapy. The patient had necrotizing fasciitis in the forearm, and the intraoperative debridement plus MPWTI plus BFGF flushing was performed. A is the preoperative photo. B is the photo after debridement. C is the photo 5 days after BFGF flushing. The granulation tissue grew well. The wound bed was prepared, and the next step of treatment could be carried out. This is the typical case of BFGF promoting healing. The patient's forearm tendon was exposed and needed artificial dermis transplantation. We adopted the BFGF to soak the artificial dermis to accelerate the vascularization process of the artificial dermis. Picture A shows the status before the surgery. The tendon was exposed. Picture B shows artificial dermis soaked in BFGF solution. Picture C shows the status immediately after artificial dermis grafting. Picture D shows the 12th day after artificial dermis transplantation. Picture E shows autologous skin transplantation. Picture F shows the status of 7 days after autologous skin transplantation. The skin graft survived well. The entire treatment took 19 days, and BFGF was effective in accelerating the vascularization process. The same method is also applicable to patients with snake bites. Snake venom can lead to self-damage and tissue necrosis. In mild cases, there will be local swelling and skin and soft tissue necrosis. In severe cases, there will be large areas of necrosis which can reach deep into the muscle fascia and periosteum. Picture A shows skin necrosis after the bite. Picture B shows tendon exposure after debridement. And post-operative negative pressure perfusion therapy combined with BFGF is adopted to wash the wound. Picture C shows the wound after the negative pressure is removed. Picture D shows BFGF combined with artificial skin to promote artificial dermis vascularization. Picture F shows BFGF promotes skin survival. This is a 45-year-old female patient who was admitted to the hospital 30 minutes after suffering a bruise on the right corner of her eye. After cosmetic suture, she was applied with gauze soaked in BFGF, and the dressing was changed once a day. We removed the sutures after 5 days and sprayed BFGF every day. Finally, it can be seen that the signs of trauma have basically disappeared and no obvious scar formation is observed. This is the application of BFGF after double eyelid surgery. We know that the place where the inner curvature turns is the most likely to produce scar hyperplasia. After surgery, she sprayed BFDF on the wound with eyes closed every day, 1 to 2 times a day. The faster the wound swelling subsides, the faster the trauma will recover, and the less upwards the scar will be seen. There are many cases of BFDF application on surgical incisions. Here is a special one, which is its application after cesarean section. This kind of incision has a thick fat layer, which is easy to liquefy the fat and takes a long time to heal. The patient applied BFDF wet compress to the wound immediately after the incision was sutured. On the first day after surgery, BFDF was sprayed 3 to 4 times a day. 15 days after surgery, the wound was completely healed without upward scar formation. Summary and review. BFDF promotes wound cell proliferation and accelerates wound healing process. BFDF has strong angiogenesis function, which promotes the formation of new blood vessels on the wound surface, creating favorable condition for wound healing. BFDF regulates the synthesis and arrangement of collagen to make the healed skin smoother and reduce scar formation. With the wider and deeper application of BFDF, we can do more exploration in the future, including exploring the specific mechanism of action in the wound healing process, expanding the application field to cover more types of wound treatment, improving drug dosage forms and administration methods, and improving patient medication compliance and treatment effects. We hope that manufacturers will organize more activities like this to strengthen the doctor training and education. Patient science popularization needs to be conducted, and clinical applications need to be expanded to benefit more patients. Finally, I would like to thank the experts and colleagues who attended this conference, and thank Mellowhope Cooperation for building such a good international platform. Let us work together to promote the internationalization of BFDF. Thank you.
Please feel free to ask if you have any questions, and please leave your message on the message board. Please take a short break of 5 or 10 minutes, and we'll be back to answer the questions. Thank you.
Great. I'm sorry. Let's start from question 1. The first question is, can MARC-BLAST enhance graft taking after skin grafting?
我觉得你这个呢，以后这些问题写在上面，你就不用念，你就直接问，问他中文，然后回过来你就让他看就行。
那还是请
可以，你就问杨主任了，还是
刚才没有继续吗？这个问题的答案是肯定的，因为 BFGF 它就有它的本来的机制就有促进组织再生然后加快血管化的这个机制在，所以它对于皮片移植后，它能加速皮片在创面的存活。
The answer to this question is positive because the mechanism of BFGF has included the promotion of tissue growth and to accelerate the vascularization. That is why after the grafting, it could accelerate the survival of the graft in the skin tissue.
在刚才分享的病例6和病例7中，我们在植皮的时候也是使用了 BFGF， 可以看到皮片在5到7天基本上就能存活啊。
In the case 6 and case 7 that was showed in this lecture, we can see that we also adopted the BFGF in the grafting process, and we can see that basically in the 5th and 7th day after the surgical, the graft survived good. that is an example of showing how the graft taking after skin grafting. 在哪些病例？
就中文的大声嘛，要有个人家看得到你问杨主任。
就在2020年就我们中华烧伤学会发布的中国应用生长因子指南里面就已经有明确的证据表明，在一些急性伤口，比如说2度的烧烫伤，还有一些切割伤、外伤等等是有非常好的 BF-GF 是有非常好的疗效的。
It is shown in the Chinese guideline of BF-GF published in the 2020 that there is some evidence to show that in some acute wounds such as degree 2 burning and some cut wounds, BF-GF has very good effect.
那随着慢性难愈性创面的患者越来越多，我们也在临床上尝试使用 BF-GF 联合合理的清创，还有负压治疗等等，去对慢性难愈性创面做一个治疗，也达到了很好的效果。之前的那个病例介绍也有介绍。
As it becomes more prevalent of the chronic trauma and chronic disease patient, we are trying to apply the BF-GF in the clinical use. We combine the debridement and the MPWT device to treat the chronic wound, and we achieve good effect. We have mentioned it in the previous introduction.
就是增生性瘢痕的有痛度。好了，根据现在的专家共识和指南，那么我们对增生性瘢痕和瘢痕疙瘩的治疗，要从伤口的阶段就开始介入要在伤口的愈合的初始就要尽快使用BF-GF 生长因子去促进伤口的愈合和胶原的去合理排列，所以达到预防瘢痕增生或者瘢痕疙瘩的一个疗效。
According to the consensus and guideline of the experts today, the treatment of the hypertrophical scar and keloid scar start from the wound treatment stage. We suggest that you should apply the BF-GF in the beginning of the wound treatment to achieve the best treatment effect and to promote the healing and the arrangement of the collagen. That is how we can prevent the scar.
对于已经形成的增生性瘢痕或者瘢痕疙瘩，我们避免不了有可能会使用到激光治疗和手术治疗，但通过这些治疗手段之后，我们也要尽早的使用建议尽早的使用 BF-GF 让它伤口加速愈合从而抑制瘢痕的一些增生。
And as for the keloid scar and hypertrophical scar that is already there, we cannot avoid to adopt the laser treatment as well as the surgical treatment. But after the laser treatment or surgical treatment, we suggest that you should adopt the BF-GF as soon as possible, or it could promote and accelerate the healing of the wound to prevent the keloid scar from happening again.
在这个渗出性伤口、这个深度烧伤还有这个蜂窝支炎方面，BF-GF的效果是如何的呢？
好的。对于深度烧伤或者蜂窝支炎、感染性创面，一定要第一个要在控制尽早的控制感染要彻底的清创，在这些工作做好之后，再使用 BF-GF， 因为 BF-GF 在坏死组织上面没有活性的组织上面，它是很难起到有很好的效果。
In the treating of exudative wounds and partial thickness burns, we suggest that you should perform the debridement, the thorough debridement and the inflammation control as soon as possible, because the BFGF cannot work on necrosis tissue or in active tissue. That is why we suggest that we should conduct the debridement and inflammation control as soon as possible.
下一个问题，这个产品能不能治疗潜在的这个感染或者是病原体？这有没有这方面的机制？还有它能不能与这个强效抗生素一起应用于临床，在这个尤其是多重耐药性动物伤口的感染？
这 BFGF 呢，它从机制方面它是没有直接抗感染的作用，但是结合临床一起使用全身或者局部的针对伤口病原菌的抗生素一起使用，那么如果它的机制是加速伤口愈合，当伤口尽快愈合后，细菌感染它就一定能得到一个很好的作用，这是一个相互促进的一个过程。
The mechanism of BFGF doesn't include the anti-infectious effect, but in the clinical practice, you could apply the BFGF together with the anti-infection treatment, because the mechanism of BFGF is to accelerate the wound healing. After the wound is healed, the infection possibility will be severely reduced. That is why we suggest you should apply BFGF to accelerate the wound healing.
就是烫伤导致的大面面积2度、3度烧伤，一般的治疗用量，这个也是我们患者最关注的一个问题。
这个问题在我们中国一个生长因子的应用指南里面也有比较明确的答案。那么我们一般是按照说明书150个单位每平方厘米，但如果条件许可的话，它是一个剂量依赖型的一个药物。你剂量稍微用大一点，它的效果也会有递增的一个作用。
The answer to this question is exhibited in the Chinese guideline of BFGF. We have a clear answer to that. And generally, we will be following the principle that is listed in the instruction, that you should guarantee at least 150 IU of this product per square centimeter in your skin. But because the product is very dosage dependent, if it's possible, we suggest you to use bigger or higher dosage. The effect will be better.
中国在生长因子的研发和临床应用方面有很长的历史，还有很丰富的经验。我们也有大量的案例。如果大家需要，我们可以把我们中国的指南到时发给他们看一下。
We have very long history and vast experience in the clinical use of the BFGF. If it is required, we could share them with you later.
下一个问题。这个有没有临床的最大用量？
目前来说，临床就也是中国的指南。目前来说，临床最大的用量大概300单位以内都是每平方厘米都是安全。目前就用超量使用也没有发现，目前还没发现有毒副作用啊各种不良反应的报道。目前来说。
According to the Chinese guideline of BFGF, the recommended biggest use of this product is no bigger than 300 IU per square centimeter in your skin. It is very safe if you use it within this limit. But in the actual practice, there is no side effect spotted with a higher dosage of use. So generally, there is no maximum dosage for use, at least from clinical experience.
在清创之后，我看看这个问题就是在清创之后，我们看到这个负压设备会应用于这个渗出性伤口上面。然后在这个负压设备的使用中，我们怎么样把这个BFGF 跟它结合起来，去治疗这个高度的渗出性创口？
我们现在在推就在MPWT 的基础上推 MPWI， 就是我们可以用生长因子进行持续性的滴注或者间歇性的滴注，去把促进创面愈合的生长因子也能运用到负压治疗的同时。
On the basis of NPWT, we are adopting the NPWTI because the I stand for irrigation, because we could apply the BFGF solution with the irrigation, and we can combine the BFGF with the MPWT in this way to treat the high exudative wounds.
Precaution， 在我们在与其他药物的这个配合食疗这个使用之中，比如说是与这个生理盐水啊，或者是这个碘水啊之类的去使用的过程中，有没有什么需要注意的？
对，我们 BFGF 因为它是生物制剂，是蛋白成分，所以我们尽量避免跟消毒剂一起去合用，生理盐水和注射用水是没问题的。我们跟那个负压滴注的时候，我们也是要用生理盐水最好用生理盐水来去配。
Because the BFGF is a biopharmaceutical product, it has the protein ingredient. That is why we suggest that you should avoid to apply this product with disinfectant. But if you are going to apply this product together with saline or chloroxidine, it is okay.
我们在使用生长因子之前，用消毒剂包括氨碘去消毒了伤口之后，我们要用生理盐水再把它清洗干净，再用 BFGF。
Okay. After the disinfectant process with iodine, we suggest that you should rinse the wound thoroughly with the saline solution before you apply the BFGF treatment.
下一个，在这个上面的讲述之中，我们看到这个我们看到这个。创面之中都有这个充分的这个血流供应，然后如果是这个血流供应不充足的这些组织，比如说这个耳朵的这个软骨部分，这个像这种血流不充分的地方，这个BFGF要怎么使用，或者在这个地方使用？
耳朵那一侧，
耳骨、软骨，他关注的就是血流不充分。
因为BFGF 它的就是说起效的机制，它是通过局部的跟局部的FGF 的受体结合产生的效应。当然血供丰富的时候，创面自己是愈合是肯定比血供欠缺的会良好的。但对使用生长因子，在血供不丰富的也是不影响的。
because the mechanism of BFGF is the BFGF works on the FGF receiver. If the blood supply is enough, the wound will heal better. Than the places with less blood supply, of course. But if the blood supply is not enough, the BFGF works also.
它在血供不丰富的地方，它也有可能加速伤口创面的局部血管化和肉芽组织的生长，从而会加速伤口的一个愈合。
In the part where the blood supply is not enough, the BFGF could also accelerate the wound healing by accelerating the vascularization and the creation of granulization tissue. As an effect, it could accelerate the wound healing.
今天时间不是很够，我们再回答最后一个问题。这个 BFGF 能不能在这个陶罐里面去存放在2到8度这个条件？就因为很多地方可能它这个电供应，刚才也看到它缺电，所以它放这个陶罐
就相当于阴凉地，阴凉地，就是 room temperature， 就像这个这样，应该是可以。
其实就 BFGF， 因为它是冻干粉的形式，所以其实它的性状是比较稳定的。我们只是建议在2到8度的冰箱储存，但只要在阴凉的地方，10度左右的温度是不会让它会影响它的那个效果的。
The BFGF is represented in the form of lyophilized powder, which has given it high stability characteristic. So it will remain stable in most cases. We recommend you to restore this product between the temperature of 2 to 8 degrees.
Not be good for you to come to a kind of gathering like this. The woe is woe, and you will not be able to remember the day. There's just walk down the aisle, you will see a background for MARC-BLAST. You can join us in this, and let's see your pictures. Thank you. Thank you. Okay, so for the online participant, the meeting is officially over. Thank you for joining us. We have your records with us and we'll get in touch with you. Thank you.